Assalamualaikum. We are Group 2 and we will be explaining the roles of cytokines in autoimmune disease. So these are our group members. Okay, so first let me explain what cytokines are and what autoimmune disease is. So we start with cytokines. Cytokines are a large diverse family of small proteins or glycoproteins that are diverse in size, and it is produced by many types of cells, which include immune cells like macrophage, B cell and T cells, and non-immune cells like fibroblasts and endothelial cells. So it acts as chemical messengers in cell signaling, especially in the immune system. And cytokines are released in response to various stimuli such as infection or tissue injury, and helps to coordinate the immune response by promoting or inhibiting inflammation. So there are three ways in which the cytokines act. It can act via autocrine, where it acts on the same cell; paracrine, where it acts on nearby cells; or endocrine, where it acts on distant cells through the bloodstream. Next, I will be explaining about the autoimmune disease. So, autoimmune disease is a condition that occurs when the immune system mistakenly considers the body cells as foreign antigen and attacks the body's healthy cells, tissues, and organs. And this can weaken the body function and even can be life-threatening. So there are over 80 recognized autoimmune disease like type 1 diabetes, multiple sclerosis, and many more. And this usually happens due to imbalance in the cytokine signaling. Generally, there are some symptoms can be recognized like fatigue, joint pain, rashes, general malaise, and low-grade fever. Another thing about autoimmune disease is that most of them have no cure and may require lifelong management.
Now we will continue with to know the comparisons between the pro-inflammatory cytokines and the anti-inflammatory cytokines. So pro-inflammatory cytokines is defined as a group of signaling molecules that promotes and intensify the inflammation caused by the activated immune response. So the main functions for pro-inflammatory cytokines is to promote the inflammation to fight infections or clear damaged tissue, to stimulate the immune cells like macrophages and T cells, increase the vascular permeability, fever, and recruitment of white blood cells, and it is important in initial defense but harmful if overactive. As for the anti-inflammatory cytokines, it's defined as a group of signaling molecules that help to control and reduce the inflammation, essentially dampening the immune response. So the main function for the anti-inflammatory cytokines is to suppress or downregulate the immune response, to prevent the excessive inflammation and tissue damage, to promote healing, immune tolerance, and resolution phase of inflammation, and also to maintain the immune balance. So we'll look at the example of the pro-inflammatory cytokines such as the tumor necrosis factor alpha, interleukin-1, CYP17, and interferon gamma, and anti-inflammatory cytokines such as interleukin-10, transformation growth factor beta, interleukin-4, and 35. So pro-inflammatory cytokines will affect inactivation of the immune cells, which then will increase the inflammation process. As for the anti-inflammatory cytokines, it will suppress the immune cells and promote the regulation and tolerance. So in autoimmunity, pro-inflammatory cytokines are overexpressed, which is causing chronic inflammation and tissue damage, while anti-inflammatory cytokines may be insufficient, dysfunction, or ignored by the immune cells, then failing to stop the attack. So basically, in autoimmune disease, where the immune system mistakenly attacks the body soft tissues, where normally a healthy immune system needs to balance both inflammatory response between anti and pro. So if there's too much of anti-inflammatory, it will lead to the immune suppression and will cause infections. While in this case of the autoimmune disease, there is too much of pro-inflammatory cytokines, which then cause autoimmunity, and then it will lead to the chronic inflammation. So for the mechanism of cytokine imbalance in autoimmunity, there are a couple of processes. The first one is the negative selection process, which eliminates the B or T cells reactive to self-antigens, encouraging self-tolerance. This process occurs in the thymus for T cells and in the bone marrow for B cells, where the ones that strongly bind to self-antigens are removed. In contrast, peripheral tolerance prevents the overreactivity of B and T cells that escape central tolerance. Mechanisms such as allergen deletion and suppression by regulatory T cells, also Tregs, are critical for maintaining peripheral tolerance. The autoimmunity depends on the balance of the T helper 1 and T helper 2 cytokine balance. Both of the T cell subsets mutually cross-regulate each other. Basically, the Th1 cytokines are at the based on the right figure. It is on the left side and the Th2 is on the right side. The abnormal activation of immune cells activated by Th1, Th17 and B cells produce excessive pro-inflammatory cytokines such as interleukin 2, interferon gamma, and tumor necrosis factor alpha, and also interleukin 7, tipping the balance towards inflammation. Also, reduce regulatory cytokines, anti-inflammatory cytokines such as the interleukin 10 and transforming growth factor beta are crucial for the immune tolerance, which are at the right side. In autoimmune diseases, their production is often reduced or impaired signal.
So, I would like to continue with the explanation of cytokines as therapeutic targets. Cytokines work as therapeutic targets because they cause inflammation in autoimmune responses. Therefore, inhibition of cytokines will lead to the cure. For example, we've got drugs such as infliximab and etanercept. They are often used in rheumatoid arthritis and Crohn's disease. They inhibit the TNF alpha, a pro-inflammatory cytokine. We've also got a drug named tocilizumab, which is commonly used in patients with joint inflammation and systemic symptoms. It inhibits interleukin 6, a pro-inflammatory cytokine as well. We've also got secukinumab and ustekinumab, used in psoriasis and multiple sclerosis. It inhibits interleukin 17 and 23, both of which are pro-inflammatory cytokines. There are several challenges upon cytokine target therapy. First of all, it is the issue of redundancy. Specific targeting for disease is difficult due to cytokines mediating multiple processes at once. Secondly, we've got excess immunosuppression. Basically, inhibition of cytokines could possibly expose patients to risks of infections. And lastly, it is the issue of capital. Production of cytokine targeting drugs are costly and requires large amount of fundings.
Cytokines in multiple autoimmune diseases. Okay, let's start with rheumatoid arthritis. In rheumatoid arthritis or RA, cytokines like TNF alpha or interleukin 6 are central mediators. They contribute to synovial inflammation and joint destruction, leading to chronic pain and disability in patients. Targeting these cytokines have proven with biologics has significantly improved the clinical outcomes for many RA patients, providing relief from inflammation and slowing their joint damage. And the next one is the SLE or systemic lupus erythematosus. Moving on to the SLE, a condition characterized by widespread inflammation. Type 1 interferons, particularly the interferon alpha, are key players in SLE by promoting autoimmunity through B cell activation and autoantibody production. Inhibiting these interferon alpha signaling has shown promise as a therapeutic strategy in managing this disease. And last but not least, which is the MS itself or multiple sclerosis. Cytokines such as interleukin 17 and TNF alpha are involved in the inflammatory processes that lead to the breakdown of myelin. This is critical for nerve function. Targeting these cytokines has led to reduced disease relapse rates and making these cytokine-based therapies an essential tool in treating the multiple sclerosis. In conclusion, cytokines are key players in autoimmune diseases, with an imbalance between pro-inflammatory and anti-inflammatory cytokines contributing to disease progression. Targeting cytokines offers therapeutic potential, but challenges remain in ensuring specificity, safety, and efficacy. Research into cytokine roles in diseases like rheumatoid arthritis, lupus, and multiple sclerosis is crucial for developing effective treatments.